Did you know some of the most common medications you take could be slowly harming your brain? You might assume these prescriptions are safe because they're FDA approved or widely used, but the reality is more complicated. In fact, certain drugs, especially when used without medical supervision, can accelerate cognitive decline, harm memory, and even increase your risk of dementia. Shocking, right? The good news is that by knowing which medications to watch out for, you can take steps to protect your brain and improve your overall health. Whether you're taking medications for chronic conditions or short-term relief, understanding their long-term impact on your brain health is crucial. Let's break it down step by step. Aging, memory loss, and medications. What's the connection? For years, people believed memory loss and cognitive decline were just part of getting older. But science has debunked this myth. Age alone isn't what causes dementia or memory issues. It's specific factors like lifestyle, genetic predisposition, and yes, medications. Medications like proton pump inhibitors, PPIs, or certain anticholinergics may seem harmless, but studies suggest they can significantly impact memory and brain health. You're about to learn why these drugs pose such a risk and how to avoid falling into their trap. But before we get into the list, let's discuss something critical. Memory loss is preventable. Yes, with the right approach, you can preserve and even improve your cognitive abilities well into your golden years. A healthy diet, regular exercise, good sleep, and most importantly, careful management of medications can make a huge difference. Medication 1. Proton pump inhibitors, PPIs. Let's kick things off with a medication you've probably seen in almost every pharmacy aisle: omeprazole and other PPIs. These drugs are often used to treat heartburn, acid reflux, and gastritis. While effective in the short term, prolonged use can cause more harm than good. Why are PPIs risky? Studies show that long-term PPI use can lead to a higher risk of dementia. One major reason is their impact on vitamin B12 absorption. This essential vitamin is crucial for brain health, and a deficiency can result in memory loss, confusion, and other neurological issues. Additionally, PPIs can disrupt your gut microbiome, which plays a surprising role in cognitive function. Research indicates that gut health and brain health are intricately connected, so when your microbiome is compromised, your brain may suffer too. Medication 2. Anticholinergics. Anticholinergics are prescribed for a variety of issues, including allergies, respiratory disorders, and overactive bladder. Medications like oxybutynin and scopolamine work by blocking acetylcholine, a neurotransmitter essential for memory and learning. The dark side of anticholinergics. Blocking acetylcholine might relieve certain symptoms, but it also interferes with how your neurons communicate. A landmark study from the University of Washington found that people who regularly used anticholinergics had a 54% higher risk of developing dementia. Alternatives like tolterodine or inhalation therapies for respiratory disorders can provide relief without the same cognitive risks. Always consult your doctor to see if switching medications is an option. Medication 3. Corticosteroids. Corticosteroids such as prednisone and dexamethasone are often prescribed for autoimmune diseases and inflammation. These drugs can be life-saving, but they come with serious risks, especially when used long-term. Corticosteroids can alter the balance of cortisol in your brain. While cortisol is essential for managing stress, too much of it can damage the hippocampus, the part of the brain responsible for memory. Symptoms like confusion, disorientation, and even mood swings often accompany prolonged corticosteroid use. If you're on these medications, work with your doctor to minimize the dose and duration. Explore non-drug treatments like physical therapy or anti-inflammatory diets to reduce your reliance on corticosteroids. Medication 4. Benzodiazepines. Next on our list are benzodiazepines or benzos, which are widely used to treat anxiety and insomnia. Drugs like alprazolam, Xanax, and lorazepam, Ativan, are known for their calming effects, but they can wreak havoc on your brain over time. Benzodiazepines are strongly associated with memory impairment and even structural brain changes. Long-term use can double your risk of developing Alzheimer's disease. This is because they slow down your brain's processing speed and interfere with the neurotransmitters involved in memory formation. If you rely on benzos, consider alternatives like cognitive behavioral therapy or relaxation techniques. These methods may take time to work, but they don't come with the same long-term risks. Medication 5. Amphetamines. If you've heard of Adderall, then you're familiar with amphetamines. These drugs are commonly prescribed for ADHD, but they also come with risks, especially when misused. While amphetamines enhance focus and energy in the short term, prolonged use can cause memory problems and even permanent brain damage. High doses of amphetamines affect dopamine levels, which play a critical role in learning and memory. Over time, these changes can reduce your cognitive flexibility and motivation. Protecting your brain, a holistic approach. If some of these medications sound familiar, don't panic. This doesn't mean you have to stop using them entirely. Instead, focus on being proactive. Here are 3 tips to protect your brain while managing your health conditions. First, work closely with your doctor. Never stop or adjust medications without medical advice. Discuss safer alternatives and weigh the risks and benefits together. Second, adopt brain-healthy habits. Exercise regularly, eat nutrient-rich foods, and prioritize good sleep hygiene. These steps can counteract some of the negative effects of medications. Lastly, monitor your cognitive health. If you notice memory lapses or cognitive changes, bring them up with your doctor. Early intervention is key. Medication 6, first-generation antihistamines. Antihistamines like diphenhydramine, commonly known as Benadryl, are a go-to for allergy relief and as a sleep aid, but their potential effects on your brain might make you think twice about using them regularly. Now let's talk about the cognitive connection. First-generation antihistamines work by blocking histamine receptors to reduce allergic reactions. However, they also have strong anticholinergic properties, which, as we discussed earlier, can interfere with acetylcholine, a neurotransmitter essential for memory and learning. Studies have shown that prolonged use of first-generation antihistamines is linked to an increased risk of dementia. One extensive study found that people using these medications regularly experience significant memory issues even after they stop taking them. Symptoms like brain fog, difficulty concentrating, and forgetfulness are not uncommon, but there is good news. Safer alternatives exist. Second-generation antihistamines like loratadine or cetirizine are just as effective and carry a much lower risk of cognitive side effects. If you rely on antihistamines, switching to these alternatives could protect your memory in the long run. Medication 7, tricyclic antidepressants. Tricyclic antidepressants, or TCAs, such as amitriptyline and nortriptyline, were once the gold standard for treating depression. While they're still prescribed for certain conditions, their impact on memory and cognitive health can't be ignored. Why TCAs are risky? These medications work by altering neurotransmitter levels in the brain, specifically serotonin and norepinephrine. However, they also block acetylcholine, leading to significant cognitive side effects. Long-term use of TCAs has been linked to memory impairment, confusion, and an increased risk of dementia. The elderly, in particular, are more susceptible to these adverse effects due to the natural decline in acetylcholine levels as we age. This makes TCAs a less than ideal choice for older adults struggling with depression or chronic pain. Modern alternatives. Fortunately, newer antidepressants like SSRIs, such as sertraline or fluoxetine, are just as effective and have a much better safety profile for brain health. If you're on a TCA and concerned about its impact on your memory, discuss switching to a safer option with your doctor. Medication 8, statins. Statins like atorvastatin and simvastatin are among the most commonly prescribed medications worldwide, used to lower cholesterol and prevent cardiovascular diseases. While they're undeniably effective for heart health, their relationship with cognitive function is more controversial. The brain cholesterol paradox. Your brain relies on cholesterol to maintain healthy cell membranes and synaptic connections. Statins work by reducing cholesterol levels, but this can also interfere with the cholesterol-dependent processes in the brain. Some studies have reported cases of memory loss, confusion, and even mood changes in patients taking statins. However, the evidence isn't entirely one-sided. Other research suggests that statins might protect against dementia by improving blood flow and reducing inflammation. This paradox makes it crucial to approach statin use on a case-by-case basis. What you can do. If you experience memory problems while on statins, don't stop taking them abruptly. Instead, discuss your symptoms with your doctor. They may adjust your dose, switch you to a different statin, or explore lifestyle changes to manage your cholesterol levels naturally. How to protect your brain while taking medications. Medications are often necessary for managing chronic conditions, but that doesn't mean you have to sacrifice your brain health. Here are some practical tips to minimize the risks. Track your symptoms. Keep a journal of any cognitive changes, such as memory lapses or confusion, and share this information with your doctor. Ask about alternatives. Many medications have newer, safer versions with fewer cognitive side effects. Don't hesitate to inquire about switching. Adopt brain-healthy habits. Exercise, a balanced diet rich in antioxidants and mental stimulation can help counteract the effects of certain medications. Limit duration. For medications like antihistamines and benzodiazepines, use them only as long as absolutely necessary. Final thoughts. Awareness is power. The medications we've discussed, proton pump inhibitors, anticholinergics, corticosteroids, benzodiazepines, amphetamines, first-generation antihistamines, tricyclic antidepressants, and statins, are all double-edged swords. They offer relief for specific conditions but can come at the cost of your cognitive health. By staying informed and proactive, you can make better decisions about your health care. Always consult your doctor before starting or stopping any medication, and remember, protecting your brain today sets the stage for a healthier, sharper future.